Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Invasive treatment strategy for older patients with myocardial infarction. Background. Whether a conservative strategy of medical therapy alone, or a strategy of medical therapy plus invasive treatment, is more beneficial in older adults with non-ST segment elevation myocardial infarction, NSTEMI, remains unclear. Methods. We conducted a prospective, multi-center, randomized trial involving patients 75 years of age or older, with NSTEMI at 48 sites in the United Kingdom. The patients were assigned in a 1-to-1 ratio to a conservative strategy of the best available medical therapy, or an invasive strategy of coronary angiography and revascularization, plus the best available medical therapy. Patients who were frail or had a high burden of coexisting conditions were eligible. The primary outcome was a composite of death from cardiovascular causes, cardiovascular death, or non-fatal myocardial infarction assessed in a time-to-event analysis. Results. A total of 1,518 patients underwent randomization, 753 patients were assigned to the invasive strategy group, and 765 to the conservative strategy group. The mean age of the patients was 82 years, 45% were women, and 32% were frail. A primary outcome event occurred in 193 patients, 25.6%, in the invasive strategy group, and 201 patients, 26.3%, in the conservative strategy group. Hazard ratio, 0.94, 95% confidence interval, c. 0.77 to 1.14, p equals 0.53, over a median follow-up of 4.1 years. Cardiovascular death occurred in 15.8% of the patients in the invasive strategy group, and 14.2% of the patients in the conservative strategy group. Hazard ratio, 1.11, 95% c. 0.86 to 1.44. Non-fatal myocardial infarction occurred in 11.7% in the invasive strategy group, and 15.0% in the conservative strategy group. Hazard ratio, 0.75, 95% c. 0.57 to 0.99. Procedural complications occurred in less than 1% of the patient's conclusions. In older adults with NSTEMI, an invasive strategy did not result in a significantly lower risk of cardiovascular death or non-fatal myocardial infarction, the composite primary outcome, than a conservative strategy over a median follow-up of 4.1 years. Randomized trial of very early medication abortion. Background. Medication abortion, with a combination of mifepristone and misoprostol, is highly effective and safe. However, there is insufficient evidence on efficacy and safety at very early gestations before a pregnancy can be visualized with ultrasonography methods. We conducted a multi-center, non-inferiority, randomized controlled trial involving women requesting medication abortion at up to 42 days of gestation with an unconfirmed intrauterine pregnancy on ultrasound examination, visualized as an empty cavity or a sac-like structure without a yolk sac or embryonic pole. Participants were randomly assigned to either immediate start of abortion, early start group, or standard care treatment delayed until intrauterine pregnancy was confirmed, standard group. The primary outcome was complete abortion. The non-inferiority margin was set at 3.0 percentage points for the absolute between group difference. Results. In total, 1,504 women were included at 26 sites in 9 countries, and were randomly assigned to the early start group, 754 participants, or the standard group, 750 participants. In an intention to treat analysis, a complete abortion occurred in 676 of 710 participants, 95.2%, in the early start group, and in 656 of 688, 95.3%, in the standard group. The absolute between group difference was minus 0.1 percentage points, 95% confidence interval, minus 2.4 to 2.1. Ectopic pregnancies occurred in 10 of 741 participants, 1.3%, in the early start group and in 6 of 724, 0.8%, in the standard group, with one rupture before diagnosis, early start group. Serious adverse events occurred in 12 of 737 participants, 1.6%, in the early start group and in 5 of 718, 0.7%, in the standard group, p equals 0.10. The majority were uncomplicated hospitalizations for treatment of ectopic pregnancy or incomplete abortion. Conclusions. Medication abortion before confirmed intrauterine pregnancy was non-inferior to standard, delayed treatment with respect to complete abortion. Neoadjuvant Nivolumab and Ipilimumab in resectable stage 3 melanoma. Background. In phase 1 to 2 trials in patients with resectable, macroscopic stage 3 melanoma, neoadjuvant immunotherapy was more efficacious than adjuvant immunotherapy methods. In this phase 3 trial, we randomly assigned patients with resectable, macroscopic, stage 3 melanoma to 2 cycles of neoadjuvant ipilimumab plus nivolumab, followed by surgery or surgery followed by 12 cycles of adjuvant nivolumab. Only patients in the neoadjuvant group with a partial response or non-response received adjuvant treatment. The primary endpoint was event-free survival. Results. A total of 423 patients underwent randomization. At a median follow-up of 9.9 months, the estimated 12-month event-free survival was 83.7%, 99.9% confidence interval, c. 73.8 to 94.8, in the neoadjuvant group, and 57.2%, 99.9% c. 45.1 to 72.7, in the adjuvant group. The difference in restricted mean survival time was 8.00 months, 99.9% c. 4.94 to 11.05, p less than 0.001, hazard ratio for progression, recurrence, or death, 0.32, 99.9% c. 0.15 to 0.66. In the neoadjuvant group, 59.0% of patients had a major pathological response, 8.0% had a partial response, 26.4% had a non-response, greater than 50% residual viable tumor, and 2.4% had progression. In 4.2%, surgery had not yet been performed or was omitted. The estimated 12-month recurrence-free survival was 95.1% in patients in the neoadjuvant group who had a major pathological response, 76.1% among those with a partial response, and 57.0% among those with a non-response. Adverse events of grade 3 or higher that were related to systemic treatment occurred in 29.7% of patients in the neoadjuvant group, and in 14.7% in the adjuvant group. Conclusions. Among patients with resectable, macroscopic stage 3 melanoma, neoadjuvant, ipilimumab plus nivolumab followed by surgery and response-driven adjuvant therapy resulted in longer event-free survival than surgery followed by adjuvant nivolumab. Final results for adjuvant Dabrafenib plus Trametinib in stage 3 melanoma. Background. The 5-year results of this trial showed that adjuvant therapy with Dabrafenib plus Trametinib resulted in longer relapse-free survival and distant metastasis-free survival than placebo among patients with BRAF V600 mutated stage 3 melanoma. Longer-term data were needed, including data regarding overall survival bottom methods. We randomly assigned 870 patients with resected stage 3 melanoma with BRAF V600 mutations to receive 12 months of Dabrafenib, 150 mg twice daily, plus Trametinib, 2 mg once daily, or 2 matched placebos. Here, we report the final results of this trial, including results for overall survival, melanoma-specific survival, relapse-free survival, and distant metastasis-free survival. Results. The median duration of follow-up was 8.33 years for Dabrafenib plus Trametinib, and 6.87 years for placebo. Kaplan-Meier estimates for overall survival favored Dabrafenib plus Trametinib over placebo, although the benefit was not significant. hazard ratio for death, 0.80, 95% confidence interval, C, 0.62 to 1.01, p equals 0.06 by stratified log rank test. A consistent survival benefit was seen across several pre-specified subgroups, including the 792 patients with melanoma with a BRAF V600E mutation, hazard ratio for death, 0.75, 95% C, 0.58 to 0.96. Relapse-free survival favored Dabrafenib plus Trametinib over placebo, hazard ratio for relapse or death, 0.52, 95% C, 0.43 to 0.63, as did distant metastasis-free survival, hazard ratio for distant metastasis or death, 0.56, 95% C, 0.44 to 0.71. No new safety signals were reported, a finding consistent with previous trial reports' conclusions. After nearly 10 years of follow-up, adjuvant therapy with Dabrafenib plus Trametinib was associated with better relapse-free survival and distant metastasis-free survival than placebo among patients with resected stage 3 melanoma. The analysis of overall survival showed that the risk of death was 20% lower with combination therapy than with placebo, but the benefit was not significant. Among patients with melanoma with a BRAF V600E mutation, the results suggest that the risk of death was 25% lower with combination therapy. Next, we will be discussing articles from Journal of American Medical Association. Post-marketing surveillance of inferior vena cava filters among U.S. Medicare beneficiaries. The SAFE-IVC Study. Question: what are the contemporary practice patterns and clinical outcomes of inferior vena cava filter, IVCF, insertion and retrieval in the U.S.? Findings in this nationwide observational analysis of more than 270,000 Medicare beneficiaries. IVCF insertion volume declined from 2013 to 2021, but retrieval frequency remained low, 15%. IVCF insertion and retrieval procedures were generally safe. Less than 1% filter-related complications at 30 days. For filters that were not retrieved during the study period, indwelling filters, risk of complications, such as filter thrombosis, accumulated over time, meaning only a minority of patients undergo IVCF retrieval, even though risks of safety events following filter procedures are low, and the risks of filter complications accumulate over time. Steps need to be taken to increase timely IVCF retrieval. A digital health behavior intervention to prevent childhood obesity. The Greenlight Plus randomized clinical trial. Question: can adding a health literacy-informed responsive text messaging and web-based dashboard intervention to health behavior counseling, delivered by pediatric primary care clinicians, support healthy growth over the first 2 years of life? Findings: a 2-group randomized trial was conducted with 900 parent-infant pairs, 86.3% retention. The intervention led to lower weight for length trajectories over the first 24 months of life. Estimated reduction at 24 months, 0.33 kilograms/m, meaning adding a digital intervention to health behavior counseling improved growth trajectories over the first 24 months among a racially and ethnically diverse population compared with health behavior counseling alone. Next, we will be discussing articles from Annals of Internal Medicine. Ensuring safe practice by late career physicians, institutional policies and implementation experiences. Background: late career physicians, LCPs, physicians working beyond age 65 to 75 years, may be at higher risk for delivering unsafe care. To oversee LCPs, some healthcare organizations, HCOs, have adopted LCP policies requiring cognitive, physical, and practice performance screening assessments. Despite recent controversies, little is known about the content and implementation of such policies' results. Although policies had many commonalities, mandatory universal screening at a trigger age around 70 years, a strategy of screening followed by in-depth assessment of positive results, and commitment to patient safety as the key motive, they varied substantially in the testing required, funding, processes after a positive screening result, and decision-making around concerning results. Policies prioritized institutional discretion in interpreting and responding to test results. Many lacked clear language about appeals or other procedural protections for physicians. Leaders were generally satisfied with policies, but reported preemptive retirements as physicians approached the screening age and cautioned that substantial investment in cultivating physicians' buy-in was required for successful rollout conclusion. Policies about LCPs are considered successful by institutional leaders. Policy variations and early adopters' implementation experiences highlight opportunities to improve physician acceptance and program rigor. Next, we will be discussing articles from British Medical Journal. SGLT2 inhibitors and mortality among patients with heart failure with reduced ejection fraction. Objective 2. Investigate the association between sodium glucose cotransporter 2. SGLT2 inhibitor use and risk of all-cause mortality among patients with heart failure with reduced ejection fraction. Conclusions. In this large database study among patients with heart failure with reduced ejection fraction, SGLT2 inhibitor use was associated with a 25% lower risk of all-cause mortality, supporting their effectiveness in routine clinical practice. Next, we will be discussing articles from Lancet. Optimal timing of anticoagulation after acute ischemic stroke with atrial fibrillation. Optimus, a multi-center, blinded endpoint, Phase 4, randomized controlled trial. Background. The optimal timing of anticoagulation for patients with acute ischemic stroke with atrial fibrillation is uncertain. We investigated the efficacy and safety of early compared with delayed initiation of direct oral anticoagulants, DOACs, in patients with acute ischemic stroke associated with atrial fibrillation. Interpretation. Early DOAC initiation within 4 days after ischemic stroke associated with atrial fibrillation was non-inferior to delayed initiation for the composite outcome of ischemic stroke, intracranial hemorrhage, unclassifiable stroke, or systemic embolism at 90 days. Our findings do not support the current common and guideline-supported practice of delaying DOAC initiation after ischemic stroke with atrial fibrillation. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Cancer Journal for Clinicians. Epidemiology, treatment patterns, and clinical outcomes in de novo oligometastatic hormone-sensitive prostate cancer. Background. This study was conducted to better characterize the epidemiology, clinical outcomes, and current treatment patterns of de novo oligometastatic hormone-sensitive prostate cancer, OMS-PET, in the United States Veterans Affairs Healthcare System. Conclusions. Approximately 20% of de novo MHSPC were oligometastatic, and OS was significantly longer in OMS-P versus non-OMS-P versus non-OMS-PE. Although potentially curative therapy use was higher in OMS-PAP versus non-OMS-PAP, the percentages were still relatively low. Future studies are warranted given potential for prolonged responses with multimodal therapy inclusive of systemic and local therapy. Here are the articles from Journal of Clinical Oncology. Addition of metastasis-directed therapy to systemic therapy for oligometastatic pancreatic ductal adenocarcinoma. Extend. A multicenter, randomized Phase 2 trial. Purpose. The Extend trial tested the hypothesis that adding comprehensive metastasis-directed therapy, MDT, to chemotherapy would improve progression-free survival, PFS, over chemotherapy alone among patients with oligometastatic pancreatic ductal adenocarcinoma, PDAC. Conclusion. This study supports the addition of MDT to systemic therapy for patients with oligometastatic PDAC. Induction of systemic immunity is a possible mechanism of benefit. These results warrant confirmatory trials to refine treatment strategy and provide external validation. Here are the articles from Journal of Hepatology. Diagnostic performance of non-invasive tests in patients with MET-ALD in a health checkup cohort. The effectiveness of NITs for detecting liver fibrosis in patients with MET-ALD is not well established. In a study of 7,918 participants undergoing MRE, FIB4 achieved an OROC of 0.85 for detecting advanced fibrosis, MRE greater than or equal to 3.6 kilopascals. Sensitivity, 71.4%. Specificity, 77.3%, and both positive, 4.6%, and negative, 99.4%, predictive values of FIB4 were similar for MET-ALD, as for MOSLD. FIB4 is established as a valuable screening tool for identifying advanced fibrosis in the MET-ALD population. Histological improvements following energy restriction and exercise. The role of insulin resistance in resolution of MASH. Diet and exercise improved liver histology in metabolic dysfunction-associated steatohepatitis. Standard of care improved metabolic health with minimal effects on histology. Peripheral, not hepatic, insulin sensitivity was related to histologic resolution. Improved substrate use at the muscle may relieve the liver of excess nutrients. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Gluten-dependent activation of CD4 plus T cells by MHC class II, expressing epithelium. Background and aims. Intestinal epithelial cell, IEC, damage is a hallmark of celiac disease, said. However, its role in gluten-dependent T cell activation is unknown. We investigated IEC gluten T cell interactions in organoid monolayers expressing human major histocompatibility complex class II, HLA-DQ 2.5, which facilitates gluten antigen recognition by CD4 plus T cells in said conclusions. Gluten antigens are efficiently presented by MHC expressing IECs, resulting in the activation of gluten-specific CD4 plus T cells, which is enhanced by gluten predigestion with microbial elastis. Therapeutics directed at IECs may offer a novel approach for modulating both adaptive and innate immunity in patients with SED. Here are the articles from Clinical Gastroenterology. Vancomycin is efficacious for treatment of heartburn in non-erosive reflux disease, a randomized trial. Background and aims. Potassium competitive acid blockers have documented efficacy for erosive esophagitis. We performed a randomized trial in United States subjects diagnosed with non-erosive reflux disease of vancomycin versus placebo for 4 weeks, followed by a 20-week active treatment extension. Conclusions. Vancomycin reduced heartburn symptoms in subjects diagnosed with non-erosive reflux disease, with the benefit appearing to begin as early as the first day of therapy. Treatment effect persisted after the initial 4-week placebo-controlled period throughout the 20-week extension period. The two vancomycin doses, 10 mg and 20 mg, were similar in efficacy. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Successful treatment of carbapenem-resistant Acinetobacter baumannii meningitis with Sulbactam durlobactam. Background. The treatment of carbapenem-resistant Acinetobacter baumannii/calcoaceticus complex, CRAB, presents significant treatment challenges. Conclusions. This case describes successful treatment of refractory CRAB meningitis with the administration of Sulbactam durlobactam and meropenem and highlights the need to be cognizant of the paradoxical effect that can be observed with broth microdilution testing of CRAB isolates with sfideracol. Next, we will be discussing articles in the field of rheumatology. Comprehensive enteroviral serology links infection and anti-melanoma differentiation associated protein 5 dermatomyositis. Objective. Idiopathic inflammatory myopathies, IMS, are a group of heterogeneous, systemic autoimmune diseases characterized by specific clinical features and, frequently, skeletal muscle inflammation. Specific subtypes of MS can be characterized by myositis-specific autoantibodies and are associated with distinct clinical phenotypes. Here, We focus on anti-melanoma differentiation-associated protein 5, MDA5 positive myositis and anti-signal recognition particle, SRP positive myositis, both of which exhibit seasonality but lack known environmental triggers. Considering the role of MDA5 as a sensor of picornaviral infections and a mediator of inflammatory signaling, our data suggest a novel etiologic link between enterovirus infection and anti-MDA5 dermatomyositis. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Factors associated with successful withdrawal of biologic agents in children with colchicine-resistant familial Mediterranean fever. Background. Familial Mediterranean fever, FMF, is a monogenic autoinflammatory disease, and colchicine is the mainstay of treatment. Approximately 5% to 10% of patients may respond inadequately to colchicine, and anti-interleukin-1, anti-IL-1, agents are important treatment options in these patients. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Aim of this study was to see whether there is any factor associated with the withdrawal of these anti-IL-1 agents, and to investigate the characteristics of colchicine-resistant FMF patients who needed biological therapy. Conclusions. Low ISSF scores before biological treatment with no accompanying exertional leg pain, subclinical inflammation, and comorbidities may be stated as an associated factors in terms of the discontinuation of biological agents in colchicine-resistant pediatric FMF patients. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Contemporary outcomes and trends for the transeptal mitral valve in valve procedure using balloon expandable transcatheter valves in the United States. Background. Previous transcatheter valve therapy registry analyses of transcatheter mitral valve and valve, MVEV, replacement of degenerated bioprosthesis reported early experience in the United States. Given recent increases in transeptal MFIV volumes and introduction of the SAPIEN 3 Ultra valve, it is important to determine contemporary outcomes for patients undergoing transeptal SAPIEN 3/SAPIEN 3 Ultra MVIV replacement. See inclusions. This multi-center, prospective study reports excellent procedural outcomes, acceptable one-year mortality rates, and a significant improvement in quality of life for patients undergoing transeptal MVIV in the contemporary era. Patients in the low-risk and intermediate-risk STS score categories had significantly better outcomes compared with those in the high-risk category. MVIV is a reasonable therapy for the majority of patients with degenerated bioprosthetic mitral valves who are anatomical candidates. Here are the articles from Journals of the American College of Cardiology. Reaffirmation of mechanistic proteomic signatures accompanying SGLT2 inhibition in patients with heart failure, a validation cohort of the Emperor program. Background. Sodium glucose cotransporter 2, SGLT2 inhibitors exert a distinctive pattern of direct biological effects on the heart and kidney under experimental conditions, but the meaningfulness of these signatures for patients with heart failure has not been fully defined. Objectives. We performed the first mechanistic validation study of large-scale proteomics in a double-blind randomized trial of any treatment in patients with heart failure. Conclusions. The replication of mechanistic signatures across discovery and validation cohorts closely aligns with the experimental effects of SGLT2 inhibitors. Thus, the actions of SGLT2 inhibitors to promote autophagy, restore mitochondrial health and production of ATP, promote iron mobilization and erythropoiesis, influence renal tubular ion reabsorption, and normalize cardiac and renal structure and function, are likely to be relevant to patients with heart failure. From JAMA Cardiology. Leadless ultrasound-based cardiac resynchronization system in heart failure. Question: is leadless left ventricular LV endocardial pacing using ultrasound energy safe and effective for providing cardiac resynchronization therapy, CRT? to patients whose conventional CRT using a coronary sinus lead failed. Findings. In this prospective clinical trial, N equals 183, 80.9% of patients were free from device and procedure-related adverse events. The average improvement in mean LV and systolic volume was -16.4%, meaning in this study, for patients with failed coronary sinus lead placement for CRT, a leadless LV pacing system using ultrasound energy holds promise as a viable alternative. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Increased prevalence of germline pathogenic CHEK2 variants in individuals with pituitary adenomas. Context. CHEK2 is a cell cycle checkpoint regulator gene with a long-established role as a clinically relevant, moderate-risk breast cancer predisposition gene, with greater risk ascribed to truncating variants than missense variants. Objective. To assess the rate and pathogenicity of CHEK2 variants amongst individuals with pituitary adenomas, PA's conclusion. This is the first study to suggest a role for the breast cancer predisposition gene, CHEK2, in pituitary tumorigenesis, with pathogenic/likely pathogenic variants found in 3% of patients with PAs. As PAs are relatively common and typically lack classic autosomal dominant family histories, risk alleles, such as these variants found in CHEK2, might be a significant contributor to PA risk in the general population. Here are the articles from Diabetes Care. Healthcare utilization and costs associated with empagliflozin in older adults with type 2 diabetes. Objective. We compared healthcare resource utilization, HCRU, and costs for inpatient and outpatient services and dispensed medications in older adults with type 2 diabetes initiating empagliflozin versus dipeptidyl peptidase 4 inhibitors, DPP4is. Conclusions. Among older adults with diabetes, empagliflozin was associated with a lower number of inpatient days, hospitalizations, ED visits, and office visits, and with lower costs of care compared with DPP4is, especially in those with history of CVD. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Frequency and longitudinal course of behavioral and neuropsychiatric symptoms in participants with genetic frontotemporal dementia. Background and objectives. Behavioral and neuropsychiatric symptoms are frequent in patients with genetic frontotemporal dementia, FTD. We aimed to describe behavioral and neuropsychiatric phenotypes in genetic FTD, quantify their temporal association, and investigate their regional association with brain atrophy. Discussion. We identified multiple clusters of behavioral and neuropsychiatric symptoms in participants with genetic FTD that relate to distinct cerebral atrophy patterns. Their severity depends on time, affected gene, sex, and education. These clinical genetic associations can guide diagnostic evaluations and the design of clinical trials for new disease-modifying and preventive treatments. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Primary ciliary dyskinesia in adult bronchiectasis. Background. Primary ciliary dyskinesia, PCD, is a rare genetic disorder caused by the malfunction of motile cilia and a specific etiology of adult bronchiectasis of unknown prevalence. A better understanding of the clinical phenotype of adults with PCD is needed to identify individuals for referral to diagnostic testing. Research question. What is the frequency of PCD among adults with bronchiectasis? How do people with PCD differ from those with other etiologies, and which clinical characteristics are independently associated with PCD? Interpretation. Within our nationally representative cohort, PCD was a common etiology of bronchiectasis. We identified few easy-to-assess phenotypic features, which may promote awareness for PCD among adults with bronchiectasis. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Discovery and validation of a volatile signature of eosinophilic airway inflammation in asthma. Rationale: volatile organic compounds, VOCs, in asthmatic breath may be associated with sputum eosinophilia. We developed a volatile biomarker signature to predict sputum eosinophilia in asthma. Conclusions: we have discovered and provided early-stage clinical validation of a volatile biomarker signature associated with eosinophilic airway inflammation. Further work is needed to translate our discovery using point-of-care clinical sensors. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Urine output and acute kidney injury in neonates/younger children, a prospective study of cardiac surgery patients with indwelling urinary catheters. Key points: using indwelling urinary catheters, urine output, UO, shows good performance in neonates and younger children. Using higher UO thresholds in neonates post-cardiac surgery improves discriminatory capacity for outcomes compared to neonatal kidney disease, improving global outcomes. In younger children, 1 to 24 months, higher UO thresholds were not better than the adult kidney disease, improving global outcomes criteria. Large discordance between creatinine-based and cystatin C-based EIG-free-S is associated with falls, hospitalizations, and death in older adults. Key points: a large EIG-VR discordance, i.e., cystatin C-based EIG-RG greater than 30% lower than creatinine-based EIG-RG, is common in older adults and increased with age. A large EG-free discordance was associated with increased risk of falls, hospitalization, and death, independent of kidney function. There are multiple ways to measure differences in creatinine and cystatin C, all produce similar associations with aging-related adverse outcomes. Here are the articles from Kidney International Reports. Systematic review of individual patient data, COVID-19 infection and vaccination-associated thrombotic microangiopathy. Introduction. Sporadic cases of atypical hemolytic uremic syndrome, AS, have been described in the literature in association with COVID-19 infection and vaccination in adults and pediatric patients. The exact mechanisms underlying COVID-19-associated thrombotic microangiopathies, TMAs, remain incompletely understood. Herein, we present a detailed meta-analysis of the clinical characteristics, outcomes, and management strategies of COVID-19-associated AS and thrombotic thrombocytopenic purpura, TTP. Conclusion. COVID-19 infection and vaccination are a potential trigger for onset or relapse of AS and TTP, especially in patients who are not on maintenance complement inhibitors or immunosuppression.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.